Hi, welcome to our channel of IGNOU Audiobooks. Indira Gandhi National Open University, School of Continuing Education, Bachelor's Degree Program, Elective Course, Gender Studies, BGSE-001 Gender Sensitization, Society, Culture and Change, Block 1 Conceptualizing Gender, Unit 12 Reproductive Health and Rights. 12.1 Introduction. Reproductive health and rights of every individual are fundamental to the well-being of the family, community, society, and development of a country. The Program of Action of the International Conference on Population and Development at Cairo in the year 1994 defined reproductive health and included the perspective individual rights under its definition. The Cairo program laid down the purpose of reproductive health as enhancement of life and personal relations and not merely counseling and care related to reproduction and sexually transmitted disease, WHO, 2015. 4. Reproductive and maternal health are major issues of concern in both developing and the developed worlds for. It impacts women and men differently. For instance, women reproductive health and rights deal with issues of pregnancy, childbirth, and individual access to contraception and safe abortion. These issues become complicated for women when it intersects with other cultural and social practices. With this background, you will learn about reproductive health and rights from a gender perspective. 12.2 Objectives. After reading this unit, you will be able to times explain the meaning of reproductive health and rights. Times comprehend the indicators of reproductive health and rights. Times discuss international conventions and their role in implementing the reproductive rights approach, and Times explain briefly about the Reproductive and Child Health Policy (RCH) in India. Let us begin with reading what is understood by reproductive health and reproductive rights of an individual. 12.3 What is reproductive health and rights? Reproductive rights are also legal rights that give freedom to individual couple to take decision with regard to reproduction and reproductive health. Jaiswal 2012. The conceptualization of reproductive health and right can be linked to the early women's struggle to demand their right to legal and safe abortion in the industrialized countries. Later, the concept of women's reproductive health was reformulated in the year 1994 at International Conference on Population and Development, ICPD, popularly known as the Cairo Conference. Cairo Conference emphasized that women's health is socially constructed, therefore it is important to understand reproductive health in the context of individual or couple's right to reproductive health. Reproductive health is recognized as human right issues also. Box No. 1. The ICPD defines reproductive rights in its Chapter 7 as follows. These rights rest on the recognition of the basic right of all couples and individuals to decide freely and responsibly the number, spacing and timing of their children and to have the information and means to do so, and the right to attain the highest standard of sexual and reproductive health. It also includes their right to make decisions concerning reproduction free of discrimination, coercion and violence. UN Population Fund, Para. 7.3. Original emphasis, cited in Jaiswal 2012, p.14. Reproductive right is a broader framework under which reproductive health was included and clearly defined. The definition of reproductive health was recognized by the Fourth World Conference on Women in 1995, known as the Beijing Declaration and Platform for Action as a human right issue for women. Reproductive rights may include the following rights for women. Times right to legal or safe abortion. Times right to birth control. Times the right of access to quality reproductive health care, and times right to education in order to make reproductive choices. Emphasis added. Amnesty International 2007, in Jaiswal 2012. 12th March 2001 What is reproductive health? Reproductive health is defined by the CARO program of action as follows. Reproductive health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and processes. Cited in Jaiswal 2012, the definition of reproductive health has implications for both women and men. The Program of Action (POA) in ICPD placed reproductive health and rights as follows. Times the right of couple and individuals to decide the number, timing and space of their children, and to have information and means to do so. Times regulate her fertility through access to information and good health services. Times have access to safe, effective, affordable, and acceptable methods of family planning of their choice for regulation of fertility. Times identification and treatment of reproductive tract infections, RTIs, and sexually transmitted diseases among women, prevention and treatment of RTIs, HIVs. Times remain free of reproductive morbidity, death, and times bear and raise healthy children. During the post-CARO period, specific recommendations were made by various international conventions to ensure reproductive rights and health of every woman. Let us read about some of the major international conventions which outline different measures to ensure reproductive health and rights at the country level. Reproductive health and rights. Box No. 2. Times Article 10(2) of the International Covenant on Economic, Social and Cultural Rights, ICSCR, rights special protection should be accorded to mothers during a reasonable period before and after childbirth. United Nations 1996. Times Article 12(2) of Convention on the Elimination of Discrimination Against Women, CEDAW, outlines, state parties shall ensure to women appropriate services in connection with pregnancy, confinement, and the postnatal period, granting free services where necessary, as well as adequate nutrition during pregnancy and lactation. United Nations, 2979. Times General Recommendation No. 24 on Article 12 of CEDAW directs states to take up the responsibility towards preventing maternal mortality. Article 14(1) of CEWAD recommends the states to take account of the problems faced by rural women and take appropriate measures to address these problems. Times Millennium Development Goal, MDG, Goal 5 Improving Maternal Health and Mortality specifies universal access to reproductive health services by 2015. Cited by Jaiswal 2012, p. 15. These are international forums in which women's reproductive rights are specified and demanded action at the state level to improve the condition of reproductive and child health in every country. In India, still majority of women don't have access to reproductive health services. We will understand the situation of maternal health in India when we will read the section on the indicators of reproductive health and rights. 12th March 2002 What is Program of Action for India under the RCH approach? Further, the POA also recommended a set of development goals for bringing a sustainable and equitable society to implement the reproductive and child health policy in India. The development goals include Sustainable Economic Development, Times Education for Girl Child, Times Promoting Gender Equity, Equality, and Women's Empowerment, Times Reduction in the Infant, Child and Maternal Mortality, and Times Universal Access to Reproductive and Sexual Health Services. Source, Srinivasan et al. 2007. These POA aims towards building a sustainable society in which the reproductive health and rights of every individual can be realized. In the year 1997, Government of India officially adopted the RCH approach and recognized the RCH program as the national policy of the Government of India. The RCH program introduced the target-free approach to family planning and framed the POA for India as times immunization of children and access to contraceptive services by the couples, times identification, prevention and treatment of RTIs and STDs, times reproductive health education and services to the adolescent girls and boys, times identification, prevention and treatment of cervical and uterine cancer for women who are in the stage of menopause, and times family planning as an integral part of the RCH program. In rural areas of India, primary healthcare centers, PHCs, are identified as the core unit to integrate the RCH approach into the national health policies of India. Auxiliary nurse midwife, ANM, became the core agent to provide basic reproductive and child health services in rural areas. Therefore, the role of ANM was further expanded as counselor, educator, service provider and coordinators of various other health programs. Srinivasan et al. 2007, pp. 2931 to 2932. These are some of the basic concepts of reproductive health and rights in India. You will be reading more about the reproductive health indicators in the next section of this unit. Check your progress. 1. Define reproductive health. 2. What are the important points on reproductive health placed before IPCD with regard to Program of Action, POA? In the following section, you will read about the indicators of reproductive health. 12.4 Indicators of reproductive health. The following are the indicators of reproductive health. Times quality of care. Reproductive rights aim at ensuring universal access to reproductive health services. The approach of providing care to the clients became an integral part of the POA. For example, the type of care provided to the clients by the service delivery systems, continuous counseling, interpersonal communication, and information sharing between the clients and the service providers become the center of the quality of care. Imparting training for the skill development is also emphasized within the POA of ICPD. According to Sadiq, 2000, the UNFPA field study of different countries revealed that there were about 45 countries which imparted training program to the service providers to implement the reproductive health and right approach in their countries. Times gender relations and women's empowerment. It is one of the indicators of reproductive health and rights. Many countries took initiative to eliminate all forms of discrimination against women, and efforts were made at the country level to create a space for gender equality. According to UNFPA report, out of 114 countries, 98 countries took positive initiatives to ensure gender equality. The positive initiatives include times establishing institutions and ministry to look into the rights of women and child, times facilitating right to education and health, times bringing legal ratification to protect the rights of women and girl child, times protecting women and girl child from harmful practices of the community. In India, few constructive initiatives include laws against sex-selective abortion, Beti Bachao Beti Padhao, Succession Act, Domestic Violence Act, Sexual Harassment Act, Verma Committee Report, Right to Education and so on. Times contraception and abortion. This is an important area of feminist inquiry within the domain of reproductive health and rights. In the year 2010, the development of pills completed its 50th years, hence many experts viewed that the contraceptive pills have impacted gender relations in significant way. For instance, the development of pills and better contraceptive methods has increased women's reproductive choice to avoid unwanted pregnancies, which in turn transforming the maternal health indicators. Unintended pregnancies may result into abortion that is illegal in many countries. In developing countries, abortion-related complications amount to maternal deaths when abortions are carried out under illegal and unsafe conditions. Globally, 13% of maternal deaths occur due to unsafe abortion. World Health Organization Regional Office for Africa 2010, cited by LIPS 2014. Times in case of India, an estimated 1.7% of pregnancies end with induced abortion. Between 4 million and 6 million abortions are done illegally. And around 9 to 16% of maternal deaths are due to unsafe abortions. Center for Reproductive Rights and Arrow 2005, cited in Whitaker 2013. Therefore, we can say that the development of pills and other contraceptive methods in some ways has expanded women's reproductive decision-making and access to safe contraception. On the contrary, there is not much development has happened towards men's access to contraception. Use of condom and sterilization through vasectomy are the most developed contraceptive methods for men. However, the effort and approach of the family and the government lack towards involving more men to accept major responsibility for contraception. LIPS 2014. When we talk about reproductive health and rights, the focus is more towards targeting women rather involving the men in this process of decision-making. Reproductive health approach emphasizes the involvement of men in reproductive decision-making can bring down the gender-based discrimination and violence against women in family and society. Therefore, Ministry of Health and Family Welfare, Government of India in its National Population Policy, 2000, emphasized the involvement of men for making contraceptive choices and make the efforts for utilizing the reproductive and child health services in India. Singh et al. 2006. Times Maternal Health. Maternal health is a significant dimension of reproductive health. Maternal health risks often increase due to pregnancy, childbirth, poverty, and social practices of early marriage and motherhood. LIPS 2014 lists some of the pregnancy-related complications as severe bleeding during and after childbirth, infections, hypertension, heart disease, diabetic, abortion, and so on. In developing countries, these complications combined with severe poverty increases the risks of maternal mortality. In developed countries, the pregnancy-related deaths are high among women who have less access to economic resources and modern medical care. In both developed and developing countries, maternal mortality is common among the women belonging to underprivileged groups. Let us read a case study to understand how women are denied of reproductive services in India. Box No. 3. Srija Jaiswal, 2012, From the Perspective of Women's Autonomy and Reproductive Rights cites this case study in her article Commercial Surrogacy in India, an Ethical Assessment of Existential Scenario. The case study is about Shanti Devi's right to life and reproductive health. She was a BPL card holder and belonged to the scheduled caste community. In 2008, she carried a dead fetus in her womb for 5 days. Although she demanded medical treatment at various hospitals, but she didn't have the money to pay the hospital fees. Finally, the fetus was removed in a government hospital, and she was discharged immediately from the hospital without realizing the condition of her physical health. She got pregnant again in less than 2 years and gave birth to a baby in January 2010 without the assistance of any skilled birth attendant and died immediately. 17. The court asked the state of Haryana to pay compensation of 2,40,000 rupees to the family of Shanti Devi because it is a form of violation of her human rights. The 11th Five-Year Plan, India specified its own of the goals as inclusive and faster growth. This is possible by bringing women and the marginalized sections of the society to mainstream development processes. Also, significant attention is on reducing maternal mortality rate in India, for which government is committed to allocate adequate resources and address obstetric emergency. In the year 2004 to 2005, Ministry of Women and Child Development (MWCD) outlined the mission statement, i.e., Budgeting for Gender Equity, Mahapatro, 2014, p. 313. In India, various institutional mechanisms and policies are formulated to realize the goal of women's empowerment. Some significant policies include Times National Health Policy, Times Common Minimum Program, Times National Rural Health Mission (NRHM) and Times RCH Program. These programs focus on women and child health, to reductive maternal, infant and child mortality, provide antenatal and postpartum care, make accessible, affordable, and appropriate health services to all with specific emphasis on women and children from marginalized sections of the society. Mohapatra 2014. In spite of states' proactive action and positive discrimination towards women, many poor women in India are still deprived of their basic health rights. There are many cases which tells that many women have hardly any access to family planning and other reproductive services in India. Let us now read a case to make you understand the point made here. This is a case about Jaitun versus Maternity Home, MCD, Janapura and ORS, in which the High Court of Delhi directed the Municipal Corporation of Delhi, MCD, and Government of National Capital Territory of Delhi to provide 50,000 Indian rupees compensation to Fatima. Fatima, a 24-year-old woman suffering from epilepsy, was forced to give birth under a tree on a crowded street of New Delhi. She was denied delivery of her baby by the maternity home in Delhi. The court said it is a case of complete failure of the public health system to implement the programs and schemes formulated for reducing maternity and neonatal mortality in India. The court said the complete failure of the implementation of the schemes, with the women not receiving attention and care in the critical weeks preceding the expected dates of delivery. They were deprived of accessing minimum health care at either home or at the public health institutions. It points to the failure of the referral system, where a poor person who is sent to a private hospital cannot be assured of quality and timely health services. Para 14 Refer Jaiswal, p. 1718. Let us read about the reproductive rights of adolescents. Reproductive rights of adolescent, ICPD clearly states the importance of reproductive and sexual health of adolescent girls and boys. In many countries, the discussion on reproductive and sexual health of young individuals is still considered to be a gray area. Therefore, ICPD put much emphasis on enabling the young people to make decisions related to reproduction and their role as parents. The UNFPA field report suggests that around 55 countries have included adolescent reproductive health in their national health plan, and non-governmental organizations, NGOs, are working in alliance with the government of their country to provide information and services related to reproductive health to the young people. The UN Special Session calls for the following program of action. The governments are supposed to provide confidential services to address effectively their reproductive and sexual health needs, respecting their cultural values and religious beliefs, emphasizing the identity and rights of the young people themselves. Furthermore, the governments are urged to include at all levels, as appropriate, of formal and non-formal schooling, education about population and health issues, including reproductive health issues. 12.5 Reproductive and Child Health Policy, a critique. One of the major challenges posed by the international organizations and advocates of women's health movements is towards integrating public health and human rights principles under the comprehensive RCH policy. The main focus of this program is to transform the conventional family planning program into a rights-based approach in which equity and empowerment of women can be ensured within the public health program. However, there is a wide gap between the public health perspective and ensuring rights and equity for women. Many health programs often fail to deal with the socio-cultural and economic conditions of the society in which both health care providers and clients are located. Therefore, in many cases the implementation of reproductive health and rights agenda became a complex issue. Datta and Mishra argue that, after many years of India's commitment to reproductive and child health policy, still the policy faces a lot of challenges in terms of understanding the concept of reproductive right. There is a lack of public understanding in viewing reproductive health in terms of women's rights. In India, advocating for reproductive health actually faces challenges for the following reasons. Times advocating for reproductive health and rights needs a proactive approach for implementation. Times the concept of reproductive health continues to evoke discomfort among the women's group, policy makers, and health practitioners. Times despite the RCH policy's goal towards women's health rights, still the government remains committed towards achieving demographic goals. Times while implementing the RCH policy in the field, concepts like rights and health have been seen as complex subjects by policy makers and the program managers. Times the concept of clubbing child health along with reproductive health of women has made it difficult to address the issues of women, independent of their maternal role and responsibility. Times RCH program to some extent has the principle of target-driven family planning approach as it continues to exclude single women from the range of services. Times RCH program is largely an expansion of the existing maternal child health family planning MCHFP package with additional services like termination of pregnancy and prevention and treatment of reproductive tract infections and sexually transmitted diseases. Times ICPD has limited women's health to the issues of safe abortion and the woman's reproductive rights to the extent of making choice over contraception. Times central concepts like a comprehensive and integrated reproductive and child health policy remain well defined in the program. For example, at the level of implementation, the health care providers feel that they are unclear about how to provide a rights-based health care facility to all the clients simultaneously. This section is adapted from MA in Gender and Development Studies. Reproductive Health and Rights. 12.6 Summing UP. This unit speaks about the reproductive health and rights of individuals. It discusses the origin of the concept of reproductive rights in international conventions. The unit tells us that women's right to reproductive health is a matter of human right issue which cannot be ignored in the context of inclusive development and women's empowerment. In the last, the unit also provides a critique of reproductive and child health policy from gender perspective. It aims at understanding reproductive health in relation to decision-making, choice and universal access to health services in India. 12.7 Keywords. Human rights-based approach. The human rights-based approach focuses on those who are most marginalized, excluded or discriminated against. This often requires an analysis of gender norms, different forms of discrimination and power imbalances to ensure that interventions reach the most marginalized segments of the population. Elements of good practices under a human rights-based approach. Times programs identify the realization of human rights as ultimate goals of development. Times people are recognized as key actors in their own development, rather than passive recipients of commodities and services. Times participation is both a means and a goal. Times strategies are empowering, not disempowering. Times both outcomes and processes are monitored and evaluated. Times programs focus on marginalized and excluded groups. Times the development process is locally owned. Times programs aim to reduce disparities and empower those left behind. Time situation analysis is used to identify immediate, underlying, and root causes of development problems. Times analysis includes all stakeholders, including the capacities of the state as the main duty bearer and the role of other non-state actors. Times human rights standards guide the formulation of measurable goals, targets, and indicators in programming. Times national accountability systems need to be strengthened with a view to ensure independent review of government performance and access to remedies for aggrieved individuals. Times strategic partnerships are developed and sustained. 12.9 Unit N Cushions 1. Explain various indicators of reproductive health. 2. Explain reproductive and child health policy with its good prints and limitations.
Thank you for watching. We will see you in the next video with the next chapter.